Friends, good evening. So we are today at the Ashoka Hotel, Delhi, and we had AI Kosha. This was a launch. This is a portal. So the MeitY, the minister was here, Ashwini Vaishnavi, along with the secretary, Mr. Krishnan. We have the principal scientific advisor, Mr. Dr. Ajay Sood was there. We had the man who heads the AI mission, the additional secretary, Abhishek Singh. And so today we have these people. So we have a lot of people who've got the fellowships. They've got the innovation challenge. They won that title, and they're holding this check as it's shown in the television today. So this is over 25 lakhs. It's grand money. Wonderful. So you would introduce yourself.
Myself, Abrar Ali.
Yes, and say yourself.
Hi, this is Girish Somunchi.
So this company, they're going to talk about their company. They're based out of Bangalore. Yes. So there's Artulus. Yeah. So you talk about Artulus and what was this innovation challenge about, and how old is your company?
Sure. I can hold this.
Yes.
The company Artilus is largely a software company. We are working in the space of artificial intelligence, developing AI for image analysis, which will help identify people with retinal abnormalities in a matter of a few seconds. Now, 90% of blindness is preventable, and retinal abnormalities form a large part of that number of people who unfortunately lose their vision. Devices like ours, the devices that we have, when they're deployed in the market in say rural areas and areas underserved areas, with our artificial intelligence being able to identify abnormalities from it, will help save millions of eyes from growing blind. The whole challenge was to use AI in the most efficient way to help people at large. What we are doing is now not just able to help identify people with retinal abnormalities at an early stage, but overall creates a great impact on the economic front as well, not just at the microeconomy, that is the patient's family members, but also on a larger scale on the Indian economy. Indian economy loses about $24 billion every single year only to blindness. Now imagine the kind of impact that identifying blindness early and treating it early will really have on the overall economy as well as the health of the country.
Wonderful. I would ask you a question. When like you're talking about rural penetration, and we have the PM Yojana, Ayushman Yojana, and Ayushman Bharat, and I was asking your friend who's today the cameraman for us. So I was asking that when somebody goes for say cataract, right? He goes to an eye surgeon. I recently went to one. I had some problem in my eye. The medical facilities means even if I could pay one, so I've gone to a charitable one, Ramakrishna Mission. Since I come from Calcutta, so I felt there is safe. So the doctor, he didn't ask me what's your problem. He just examined me and he wrote a prescription which says that cataract has started and he gave me some drops, right? Then I went to my cousin, Dr. Sanjay Chaudhary, he's a big eye surgeon. And he said, no, no need to put those drops. So somewhere despite being educated, despite being in media, I realized that I have to do nothing, wait for the cataract to, mature, and then he's going to treat me. And today when I heard this retinal thing, and about diabetic, so I was asking that, does it help? So he said, I was told that cataract is in the front, it's in the lens, right? So if you could tell more about that.
Uh, if you're talking about cataract is, if we talk about our eye, cataract is the anterior part of the eye, which is the front part of the eye. While we specialize or harness our softwares in the back part, which is the retinal part
But
of
you
the.
need some equipment.
That is correct. We
Yes.
have got a very exclusive and modernized equipment which does not need any trained operator to operate the device.
Are
While
the devices being made in India or
yes, all these devices are made in India, and it's one of a kind. Most of the devices, the challenge lies is either the lack of infrastructure that we have in the country, and we are there to fill in that gap. This device does not require any operator to operate it. Anybody who's partially trained, even to type names on a mobile phone, will be able to operate it. The challenge lies with retinal screening is that we are a lot of operator dependent, and then that goes back to the doctor. The doctor sees it, and there is a huge doctor to patient gap. That is where the problem lies. And as my colleague Mr. Girish was mentioning, 90% of the cases are preventable when detected early. Our software and our technology bridges that gap, and we are able to detect these cases at a very, very early stage with our immaculate image quality and the precision of AI that comes into the picture.
where the patient does not need a doctor for a visit are AI detects, and only those referable cases which a doctor needs where he needs a doctor assistance, goes back to the doctor, sees the doctor, and gets treated. Now, with the kind of population that we have of 1.5 billion, there is a huge doctor to patient gap. There is only one doctor for nearly 150,000 patients, could only be possible and could be tackled with the use of technology, with the use of devices like us, with the use of AI. And fortunately, government of India is taking great initiatives with the programs Ayushman Bharat and other initiatives with the government of India. And we, as industry partners, it is our honor and privilege to get this award. And we would like to thank the government of India and Maggie and everybody involved with this project for giving us this award. Thank you so much. We are here to make a difference, and make a difference not just to the society, to the people's life and government of India at large, so that as a nation, the whole world sees us and we could be the front runners, as Dr. Sri Aishwani Vaishnavji mentioned, that with a fraction of the cost, we could be competing with the best in the world.
I want to ask this question to Girish. When we had the pulse polio and recently the corona pandemic, so India was really way ahead from the other countries. So can we not, with your people, who are already into this, you're quite old company, 7 years, so can we not have a mission with the government support where every household, like we have not had a census, but every household, and at what age should this start with the examination? So can we have a kind of a mission?
So in terms of public health overall, trying to understand the kind of nature of this particular disease, there are a good number of epidemiological studies that have already been conducted by the government. Of course, we cannot reach every household the way we reach in a census, probably, but a research which is large enough to be indicative of the health of the retina, health of the eye, is something that is being conducted on a regular basis. Not just that, there's a great amount of work funded by ICMR which has been done in identifying diabetes as well as pre-diabetes. Which now diabetes will lead to retina in all likelihood. A large part of them will lead to retinal damages. So that is what I was saying. Not just eye-related conditions, but also to understand the state of diabetes is something that the government has spent a good amount of money on. I'll include ICMR also under the government banner here. In addition to that, one of the most important developments that has happened in this space is the fact that this has avoidable blindness or preventable blindness has become a part of the United Nations Sustainable Development Goal. And India too is committed to something called Vision 2020. So we want to bring in avoidable blindness to under 0.3% of the total population, and that's a very ambitious goal. The government is very actively working on it. I'll give you an example. Yeah, absolutely. It is not an easy task for sure, but there's good amount of work that the government is doing, especially on two fronts. One is from the ABPMJY model, where cataract as well as refraction is something that the government has been funding, reimbursing for most of the surgeries that are being conducted across the country, because of which we can clearly see a huge spurt in the number of cataract surgeries that are happening. Now, with a good amount of development that's happened on the cataract front, on the lens front or the anterior front, as Mr. Abrar mentioned, there's a good amount of work that has started on the posterior front as well. Screening for diabetic retinopathy and glaucoma, two of the most vision-threatening conditions of the retina, has started getting reimbursed by the government in 10 states across the country. So that's a great step forward. That's exactly. So this is the clinic that is empaneled with the ABPMJY gets reimbursed when they screen anybody holding an ABHA card, anybody, irrespective of whether you have diabetes or you don't have a diabetes. Right? If you get screened, the institute gets X amount of money, and that's a significant amount of money that the government is paying for these tests. Exactly. That's exactly where it should. Right. There's one more point that I wanted to mention about the previous question that you had asked, because that was about two doctors having different opinions. Right? Cataract is a condition where there are clearly two schools of thoughts. Right? Each doctor from their end is actually correct. Right? So exactly. So both are correct. The only thing is you need to decide which doctor would you want to, which school of thought or which opinion would you want to subscribe to.
How long you can
Exactly.
live with that disease. So I think this company is something to watch out in the AI space, and I also wish them all the best. And India is a huge country, but I've spoken to so many other people, and I said we have our neighboring countries like Nepal who also depend on India today, And then you have like in medical tourism is there. So there are companies, there are people I see in neuro. If you go to a Fortis or you go to an Apollo, so there are people from African countries who are dependent on India. So what's your say on this? Means from people from outside India, how's the disease prevalent there? Anything you want to say? Share on that?
So diabetes, especially when we talk about diabetes as a condition, is increasing at an alarming rate globally. And diabetes has unfortunately one of the outcomes, and diabetes being a condition which is an end organ damaging condition. End organs will include the eyes, kidneys, the feet, exactly. So because of which retinal abnormalities are only going to increase. Apart from that, we've got conditions like glaucoma, we've got conditions like AMD, macular degenerations. So all of these kind of conditions, which are vision threatening conditions, are only on the rise. Because of which a need for, even in other countries, absolutely, and this is a global phenomena. Even the developed countries are facing the same challenges. The only advantage there is because of the health systems there, they are able to diagnose patients a little earlier as compared to the developing nations. Especially in the developing nations, given the kind of doctor patient ratio that we have globally, technology is the only thing that can bridge the gap. And that is the reason why technology like ours and many others of the 15,000 plus healthcare startups that we have in the country will help solve a lot of healthcare related problems, is what we feel.
I think Abral with the last word about your company, what you're doing in the next 10 years.
Our in the next 10 years, we have got a lot of work to do with the kind of work that we have started, and we intend to do a lot of good things in time to come, including just not restricted to the eye, going on to the heart, the lungs, skin related diseases which can detect, which
Also
can be
ENT.
detected. ANT also is, it's also one of them. So right now the entire focus is on the eye, and there are other works which is going on in the validation stage. And primarily at this point of time, India is the diabetic capital of the world. And with uh,
The capital of India and the diabetic capital.
so India is the diabetic capital of the world, and more importantly, the study says 1 out of 3 diabetics have a possibility of losing partial or complete vision in time to come. Diabetes is something which leads to blindness. Diabetes is something which can, damage not just heart, lungs, or your feet. Your eye being a very, very significant part of a human body, it damages that. And moreover, our work at this point of primarily focusing on retina and how we'll be able to bridge that gap. We have made immense progress, and with institutions, the government of India supporting us in a large fronts, and the kind of work that we are doing on the field, we are here to make a difference and for the world to show that India empowers AI technology at a fraction of the cost compared to the rest of the world.
Thank you very much. Thank, what's his name? Shubhadeep. Thank you very much, our cameraman, the AI cameraman, instead of me doing that. Thank you. Thank you. Pleasure, sir. Yes, thank you. You want to be in the picture? Just keep on. I'll get you the picture. Please go. Yes, he's a man of